Hi, I'm Jaimi with Cruz CORE, and if you noticed today, we're not in the studio. Today we're in a different room. Our room is the osteopath room is what we call it, and it's actually across the street from our downtown River Street location. And what's so great about it is that we have a hyperbaric oxygen therapy chamber here, and this is where we have our doctor of osteopathy work to do prolotherapy. Prolotherapy is awesome. I am such a proponent of it, and one of the reasons is because it really can help you heal non-surgically. I had a labral tear in my hip, and through the work of prolotherapy and stem cell, I was able to heal it. So maybe you've heard about prolotherapy, maybe you haven't. It stands for proliferation therapy, and there's 3 different types. We have prolotherapy, which is the use of dextrose, which is sugar water. We have PRP, which is platelet-rich plasma, where we take your blood, spin it down, and have cytokines and growth factors in the blood, and use that to inject into your tissue. And then we have stem cell that can be harvested either with bone marrow or adipose fat tissue. So what's the difference? Obviously the material is different, but also the way in which it helps your body is different. So your body has a 6 to 8 week healing cycle. After the 6 to 8 weeks, the body kind of is as good as it's gonna get. What prolotherapy or proliferation therapy does is it reinvigorates that inflammatory response to get the body to focus again on that injured area and heal the tissue. With proliferation therapy or prolotherapy with dextrose, they inject a small amount into the tissue of sugar water, and what it does is it invigorates the inflammatory response. So we're getting the inflammatory response. The price of that particular injection is less than if you did stem cell or platelet-rich plasma, PRP, because there's less materials involved. With PRP, you're going to maybe use a little bit deeper of a needle because you're going to go into maybe a deeper level of tissue. And you're not just invigorating the inflammatory response, which is very, very localized. I know we're so afraid of the word inflammation, and we do all these things to have anti-inflammatory diets, which is awesome. But the inflammatory response is so important for our body's ability to heal. And so we're creating the inflammatory response in a localized area to be able to have the body and all the growth factors go to that area to go, oh my goodness, I need to heal that knee or that hip or that shoulder or the wrist. So what we're gonna do is go ahead and inject the blood into the area, and then that blood has cytokines and growth factors, and that's with PRP. Prolotherapy, PRP, and stem cell regenerative therapies are all used to get your body functioning optimally and get you out of pain. So if you have any joint pain, if you have degenerative disc disease, if you have torn ligaments, torn cartilage, arthritis, bone spurs in your joints, in your shoulder, in your knees, in your back. If you don't want to have a surgery, this is the type of treatment that would be best for you. 90% of all surgeries can be avoided with this regenerative therapy. And a lot of the times there's no guarantee, well, there's never a guarantee if surgery is going to actually work or not. I mean, you always run the risk. So this is a really minimally invasive procedure that can actually transform your life. Today we talked about non-surgical approaches to get you to function better. We're excited to be able to bring it to Santa Cruz, and if you're interested, we do complimentary consultations to see what procedure would be best for you. Go ahead and give us a call at 831-425-9500 or check us out online. Remember, it's often the start that stops us, so get started today.